Hi everyone, my name is Kristen Brown and this is a teaching video for Nursing 305 Informatics for the Lock Havens RN to BSN program. My topic today is about DVTs and PEs. So let's get started. Some of the things I'll be going over today are the basics of blood clots, the differences between DVTs and PEs, risk factors, signs and symptoms, diagnostic tests, treatments, and prevention. So here's the basics. Blood clots occur when blood thickens and clumps together from various reasons. For example, clotting disorders, stagnant lifestyles, dehydration, pooling of the blood in extremities, poor diet, and even genetics. Most deep vein clots occur in the lower leg or thigh, but they can also occur in any other parts of the body, even in your neck or your arms. A blood clot deep in the vein can break off and travel through the bloodstream. The loose clot is called an embolism. It can travel through the heart to the artery in the lungs and block blood flow, or even travel to the brain, causing a stroke or a CVA. A PE is a very serious condition. It can damage the lung or other organs in the body and potentially even cause death if not treated immediately. Blood clots in the thighs are typically the ones more likely to break off and cause PEs, other than blood clots in the lower legs or other parts of the body. But blood clots can form anywhere, even in veins closer to the skin surface. However, these clots don't typically break off and cause PEs. Some of the risk factors, and the most common ones, are long air travel and long vehicle trips. These are the most talked about risk factors for PEs. Other acquired risk factors include obesity, cigarette smoking, hypertension, immobilization, surgery or trauma, and dehydration. PEs are also prominent in a woman's health issue because of the oral contraceptives, pregnancy, and even hormone replacement therapy. Chronic medical illnesses such as congestive heart failure and chronic obstructive pulmonary disease and even some cancers predetermine people to blood clots. The signs and symptoms may vary slightly, but all are very important to talk about. DVTs most often originate in the lower extremities with a persistent cramping or a Charlie horse feel that intensifies over several days. It usually hurts to flex the foot upwards towards your shin and is often mistaken for a calf muscle strain, sometimes happening behind the knee and even in the thighs. Leg swelling and discoloration or streaking may accompany the increase in discomfort. An upper extremity DVT may cause unexplained upper arm or even some neck swelling. In PEs, unexplained shortness of breath is the most common symptom. Chest discomfort, which is usually worse with deep breathing or coughing, a general sense of anxiety or nervousness, lightheadedness, or even blacking out. Many patients with PEs have a vague sense that something is wrong and may not be able to pinpoint it completely, so they often delay seeking medical attention. At times, because the symptoms are so vague and nonspecific, medical professionals will diagnose anxiety versus a PE. To diagnose a DVT, an ultrasound is used to look at the blood flow in the veins. It can detect blockages or blood clots in the deep veins. To establish a diagnosis for a PE, the most commonly used test is a CTA scan of the chest, which is computed tomography angiogram. This is IV contrast that is injected into you to determine the problematic areas. In other cases, a blood test called a D-dimer may be able to be run also to detect if there's need for a further clot study. These tests are the most three definitive tests in diagnosing blood clots. Some of the treatments that are involved with blood clots usually begins with some kind of injectable anticoagulant, either a heparin or a Lovenox, and then moving on to an oral blood thinner, as you can see here in this slide. Pradaxa and Eliquis, Xarelto, things like that are the oral anticoagulants that people may be on for longer periods of time. There's also thrombolytics. These are often referred to as clot busters, and these are injected directly into the bloodstream and they target the blood clot to break it up. These are used very rarely in more severe cases. There's also this little gadget called either a Greenfield filter or an IVC filter, which is an inferior vena cava filter. This will be inserted up through the groin, and it acts like a little basket to capture the clot or the embolus before it reaches the lungs. This is implanted surgically and remains in the patient's body until the doctor pulls it out, or it just sits in there. So when these are used when oral anticoagulants aren't working well enough, that they need something a little more invasive. All in all, prevention is the key step in combating blood clots. There are things you can do to help yourself and loved ones who may have been diagnosed with a blood clot. Diet changes, exercise changes, general lifestyle changes like quitting smoking, discussions with your primary care doctor are all good steps in the prevention of DVTs and PEs. So DVTs and PEs are a very serious condition that can result in further medical complications and need to be treated immediately, but also ones that can be prevented pretty easily. What you know could save you or a loved one. Thank you for watching.